Hi guys, welcome back. We shall be talking about the urinary tract infection, and before I start we want to say that this is more common in females, less common in males. So what is urinary tract infection? In very simple words, it means you are having infection in the urinary tract system. So what are the systems involved, organs involved? You are having the kidneys, then you are having the ureter, then you are having the bladder, and you are having the urethra. Now you are having two kidneys. Now these two kidneys are connected to the urinary bladder by ureter. Ureter is a pipeline structure is connecting your kidney to your urinary bladder. Now from bladder it is connected to your penis. It is connected by a structure known as a urethra. Okay, urethral opening in females, and inside your penis we are having the urethra going in. Right, so why a female is having more chances of urinary tract infection as compared to males? There are mainly two reasons for this. The urethra of male are longer, and males are having a gland that is known as prostate. Now this prostate, it releases a secretion which is known as bactericidal secretion. Now these two things are absent in female. In female the urethra is shorter and there is no prostate. So if a urethra is shorter, the organism can travel up more faster as compared to in males. That is the two reasons why females are having more chances of developing urinary tract infection. In fact, 1 to 3% of women by the age of 20 years will develop urinary tract infection, and along with that passage of 1 decade after 20 years, there is increase in chance of increasing urinary tract infection by 1% more in females. Comparing to with males, males are having very less chance to develop urinary tract infection, but yes, there are two exceptions. If your age is from 0 to 1 year, that is if you are a very small kid, you are having more chance, and if your age is more than 60 years or more, you are having more chance. Why 60 years or more in females? Because around 60 years or more, slowly your benign prostatic, you develop a condition which is known as benign prostatic hyperplasia. That means your prostate gland, it starts to swell up. When it swells up, it compresses the urethra, and whenever it compresses the urethra, it is compressing the urinary outflow, and there is no complete urine outflow. Remember, anything which is in the state of motion in your entire human body, maybe it is blood, maybe any secretion, maybe urine, maybe any secretion, maybe food even, if you stop it, it will act as a breeding ground of organism. Infection will start there. Right, so this is about the urinary tract infection. Now, how do you know that you are having urinary tract infection? There are some symptoms along with this. Now, symptoms of the urinary tract infection will be, you will be having burning sensation whenever you urinate. Whenever you will be having burning sensation whenever you are urinating, because that thing is irritated. Along with this, whenever you will be having increased frequency. That means you are increasing number of frequency of urination, because your body is not able to throw all the urine. It's a painful process, or there is some tumor. You're not able to urinate adequately, so you are going multiple times. Along with this, the urgency will increase. That means if you are feeling like you are urinating, you immediately need to go and urinate. Along with this, you will be having suprapubic pain during the process of urination or just after the process of urination. What is the suprapubic area? That the area which is below your belly button. It's around 1 inch below your belly button. Along with this, you will be having, whenever you urinate, the urine color can be cloudy. With this, you can see blood, or you might not be able to see blood in your urine. So these are the symptoms of urinary tract infection. Along with that, one of the very important symptom is that once you complete your urination, you again feel the urgency to urinate again immediately. So these are the symptoms that will suggest that you might be having urinary tract infection. Now, yes, is there any investigation that we need to do? Yes, there are some investigation. We will take your urine and we will see for any organism present there or not. We'll place it on the slide. We'll try to see, is there any cells, is there any pus there or not, or is there any organism. Along with that, we will see, is there any protein, because proteins are not supposed to be released in urine. If the protein has been released, it means that you are having some issue with your kidneys or some issue with your urinary tract. Along with that, we will do a complete blood count. We will do a complete blood count to see if the WBC counts are up. It will show that you are having some sort of infection in the body. Along with it, we will do a creatinine test to find out the functioning of your kidneys. With this, we will do electrolyte balance. We'll try to see electrolyte balance. Along with this, we will do a urea count. What is the normal range of your urea in your body? Along with this, we can also do ultrasonography of the urinary bladder, and to find out if there's any tumor, if there's any stone, if there's any stricture, if there's any tumor that is compressing the outflow. With this, if you are a male, we can do a prostate examination by a rectum, anal site, to see if the prostate size is increased. Or if you are a female, you will be done a pelvic examination to see if there's any swelling or something as of like that. Along with this, we will do a general examination. We'll try to find out is there any family history that you are having some chronic previous history of your urinary tract infection or not, because multiple times of urinary tract infection or previous history of urinary tract infection, we need to be a bit more cautious. That why are you developing urinary tract infection again and again? See, urinary tract infection, if you develop urinary tract infection, there is very less chance that you will infect even your kidneys. Now, if you infect your kidneys, this is known as acute pyelonephritis. Now, this is a serious condition. Now, what is acute pyelonephritis? We will be having 3 triad here. Now, you will be having pain on your loid area. Now, what is your loid area? It's the area on your back, which is just adjacent to your spinal cord. Now, yes, this loid pain can be misunderstood or misinterpreted as low back pain. Along with this, you will be having fever, and whenever you press on the area above the kidney, you will be having tenderness. Now, what is the tenderness? Whenever you press on the area, then you feel the pain, that is known as tenderness. Along with this, you can have rigors. Whenever you're having fever, you might have rigor, that means shaking. This is known as rigor. Along with that, you might even have low blood pressure. So this symptom suggests that you have developed acute pyelonephritis. Remember, acute pyelonephritis is less common. And remember the urinary tract infection signs, okay? Burning sensation, you will be having pain on the suprapubic area, frequency will be increased, you will be having increased urgency. Just after the urinating, you will again feel like to urinate. You might see blood in your urine, and again at the same time, you might see the color of urine has changed, like cloudy, and there's a lot of foam like substances. Like if there's a lot of foam in your urine for a long time, then it suggests that you are actually losing protein in your urine, which is not a good sign, right? So once you know that you are having urinary tract infection, so what would you do now? Like, okay, I know that I'm having urinary tract infection, so what am I supposed to do now? Once you do the investigation, you confirm that you're having urinary tract infection. Now the treatment part. Now the treatment part here is that we will give you antibiotics. It's very, very common that we give you antibiotics. Antibiotics most likely will give you fluoxetine groups, that is ciprofloxacin, norfloxacin, all this fluoxetine group of antibiotics. This is very, very effective for this. Amoxicillin is not used nowadays because of developing of lot of resistance against this antibiotic. Now, at the same time, we will also want to do a urine culture to find out what is the organism and to find out the antibiotic resistance sensitivity. What is it sensitive to, which kind of antibiotic? Now, what is it done in this thing? We'll take the urine and we will place it on some plate, and we have multiple number of plates which are coated with antibiotics. Okay, we are having a lot of antibiotics, and we'll take one drop of urine and place in each of the plates. Now, these plates, remember, is containing different type of antibiotics, maybe tetracycline, amoxicillin, azithromycin, norfloxacin, ciprofloxacin, doxycycline, any kind of large number of antibiotics are there. So in any plate, if the organism is not able to grow, if it is not able to culture, that means that antibiotic is sensitive to that organism. Now, what is culture? That means if I took around 100 bacteria, I'm just giving an example. If I took around 100 bacteria, I can culture it and I can make it many times, maybe 10,000, 20,000, maybe 1,000, anything. I can grow it as much as I want. Okay, that is known as culture. Now, if the antibiotic is effective against that organism cannot be cultured. Okay, that's how we find out, yes, this organism is effective against this antibiotic. Okay, sorry, antibiotic effective against this organism. So remember, but again, this culture takes some time. So if the patient is very critical, we don't wait for this process. So we immediately go and give a broad spectrum antibiotic, right? So if a person is having recurrent UTI, recurrent urinary tract infection, you should be more cautious that why is that person having recurrent UTI? there can be some sort of tumor, there can be some obstruction in the outflow, there can be some issue with the urethra or ureter, or there can be a swelling, there can be something compressing the outflow tract. So we need a more specific more specific investigation for this. Now once you know this, and for some special tips for women who are having urinary tract infection, recurrent urinary tract infection in females, there are some tips that you should follow. Before any sexual intercourse, you're supposed to urinate, and after sexual intercourse, urinate. Along with that, please urinate as frequently as possible. That means whenever you feel the urge to urinate, urinate it, empty your bladder and empty your bladder completely. It's not that you're going to stop it in midway. Along with this, you maintain a good personal hygiene. Along with that, you are supposed to drink at least 2 liters of water every day. And some studies have shown that cranberry juice is effective for urinary tract infection. So females, again, you should be a bit more careful because you're having more chances of urinary tract infection as compared to males. Females, maintain good hygiene, urinate completely and regularly. Whenever you feel the urge to urinate, before sexual intercourse, urinate, and after sexual intercourse, urinate. Along with this, cranberry juice is effective. And overall symptoms for anyone, male or female, of urinary tract infection, remember, please, you'll be having suprapubic pain, you'll be having burning sensation whenever you urinate, your urine might be having blood. Along with that, you might be having cloudy color urine. With that, you might be having increased frequency. The frequency, number of times you're going to urination is increased. At the same time, urgency is increased. You're very urgent. Whenever you feel urinating, you immediately need to go. That is known as urgency. Along with this, might be having difficulty in starting your urination, or at the same time you will be having blood. Now this blood can be seen, you might not be able to see. Okay, if there's very less amount of blood, you might not be able to see that. Along with this, whenever you urinate, please see the urine. Is there a lot of froth production or like bubbles production or not? If there are a lot and it's for a very long time, you should be you should go and meet your doctor to think that you might be having some protein leak there. Okay, so this was about the urinary tract infection. Again, regarding the treatment is antibiotics is the treatment, and investigation is again complete blood count. We'll do a creatinine check for you. We'll check for the WBC count. The WBC count will go up. Along with this, USG of the abdomen or the pelvis area. Males, they might need to go to check their prostate examination. Females, pelvic examination. In certain cases, we might even do cystoscope. That means we will enter a device through your penis to see your urinary bladder. Is there anything that is actually hampering that? Along with that, you might also need to do a urine culture. With that, your antibiotic sensitivity test for your urine to see which antibiotic is very effective for that organism. And the antibiotic very commonly use a fluoxetine group of antibiotics, ciprofloxacin, norfloxacin. These groups have been used. Amoxicillin is not used nowadays because of antibiotics and resistivity. And before I end up this video, I'd like to tell you why we are having so much of antibiotic resistivity. Because using wrong antibiotics, using inappropriate dose, stopping the antibiotic in the midway, and you're over abusing antibiotics. And it also comes from animal poultry farming, because these chickens and animals are not kept in a very good hygiene, so they have been fed with antibiotics in order for them not to die. So once you keep on eating a lot of this hormone feed and this poultry, chicken, all this stuff, then actually you are slowly exposing yourself to a lot of antibiotics. So this was about urinary tract infection. Women's, please be careful about this. Males, less chance. Remember the symptoms, and if you're having urinary tract infection, please do not avoid it. Okay, this can become severe if it affects your kidneys. Okay, that's all for now. Thank you, and I'll see you later.